Many people already know that 120 over 80 is the normal range for blood pressure. But is 120 over 80 still considered normal in your 20s versus your 50s, 60s, and 70s? As we age, our blood vessels lose their elasticity and become stiff. Let's say it takes about 30 seconds to make a full circulation of the blood in your 20s, and 120 over 80 is doing a great job. But let's say in your 60s, with the same power of 120 over 80, it takes about 1 minute to make a full circulation. Because as the vessels become stiff, our body needs to increase its power to make the proper delivery of the blood. When you have a high blood pressure, most patients only monitor two numbers, the higher number and the lower number. But there's something called pulse pressure, and it'll be very beneficial if you monitor this number too. You can assume two conditions with this pulse pressure. The first one is how flexible or elastic our vessels are, and the second one is how well our heart is pumping blood. Checking the pulse pressure is simple. You basically subtract the smaller number from the large number. If your blood pressure is 120 over 80, it's 120 minus 80, which is 40, and this 40 is your pulse pressure. The normal range of this number is between 40 and 60. So whenever you check your blood pressure, make sure to subtract and remember this number as well. If the number is higher than 60, the risk of heart condition increases, and here's how. When we measure blood pressure, we have two numbers, systolic and diastolic. Systolic show a pressure of your heart contraction, and diastolic show when the heart releases it. When our heart contracts, that's when the heart sends the blood out to your body. And then when the heart relaxes, that's when circulated blood fills the heart. The diastolic number is low and pulse pressure becomes higher, it means that the time between each heart contraction is getting longer, indicating the inadequate blood supply to the heart. What are the causes of higher pulse pressure? The main reason would be arteriosclerosis. As vessel condition decreases and lose elasticity, they become more stiff, leading to an increase in pulse pressure. Another scenario would be hyperthyroidism. When our thyroid overworks, higher pulse pressure can be observed. Additionally, higher pulse pressure can be seen in cases of a severe anemia. And when pulse pressure is higher than 60, half of men tend to show low testosterone levels. So there's something called narrow pulse pressure, which is when your pulse pressure is lower than 40. This narrow pulse pressure could be caused by chronic heart failure, aortic stenosis, or blood loss. So when you check your blood pressure, please do simple math to assess your heart and blood vessel.